If you have ever visited multiple dentists for the same problem, you may have experienced something interesting. One dentist suggests braces, another suggests aligners, and the third one suggests veneers. Suddenly you are wondering, how can three different dentists suggest three different treatment plans for the same smile? It's a very common question, and honestly, it may confuse patients. People start wondering, is someone trying to sell me something? Is this treatment is better than the another? Or who should I trust? The reality is usually much simpler than that, because the dentistry has evolved tremendously in the last few decades. One of the biggest reasons treatment recommendation may differ because the way we plan dentistry has changed. Today many patients prefer digitally planned dentistry. It's not because it's fashionable, it's not because it's high tech, because it helps them to understand the treatment better and giving them confidence enough for the decision making. And that's what today I want to discuss about. Before we talk about digital dentistry, we need to understand something important. Traditional dentistry has served millions of people, and all this current knowledge of digital dentistry is thoroughly based on the years of clinical research, knowledge and experience on the basis of conventional dentistry. So this is not a story about new dentistry versus old dentistry. This is not saying this is good, this is bad. This is all about predictability. Traditionally, dentists relied heavily on their experience, physical impressions, x-rays, and many great results had been achieved. But there was one significant problem. Dentists could see or imagine the outcome, but patient couldn't. The dentist could often see the destination, and many times he would ask, "Doctor, how would this look?" And every time the dentist used to respond, "Trust me, it will look good." Now the trust is important. And the trust becomes so much easier when can patient visualize the plan and understand the plan. So here the digital dentistry changed the experience. When patients hear the term digital dentistry, they imagine robots, machines, some futuristic technology. But no, digital dentistry is much simpler. It means using technology to gather all the important information to make a predictable treatment outcome. So in a simpler word, if you want to build a house, so would you want to build a house without any proper blueprint? Probably not. So yes, you would want measurements, layout, plan, and clear understanding what you want to build. The same principle applies in dentistry. Better planning and smoother execution. Today we have tools that allows us to plan a treatment in a way simply they weren't available years ago. Today we have digital prime scan, CBCT, CAD/CAM software, smile design software to assess, examine and make a predictable treatment outcome. Invisalign smile simulation is one of the great tools to imagine and even visualize how the outcome after the treatment. It's an important tool for understanding and being a part of the treatment plan for that patient. The goal of digital dentistry is not to replace the dentist, is to help the dentist to make better decisions. One of the biggest reasons patient prefers to go for digitally planned dentistry because they can actually see what's happening. Imagine you are considering Invisalign. In the past, if someone wanted orthodontic correction of the teeth, so they just would have imagined the final outcome. Today with the digital planning, with the help of Invisalign smile simulation, we can show the patient how the teeth will move over the time along with the predictable outcome. Now suddenly the conversation changes. Patient is no longer imagine what would be the futuristic smile. He can actually see it. Because instead of discussing possibilities only with the words, we can show visuals, measurements and real outcomes. That creates confidence. Many people think patients love the technology. No, they don't. They usually don't wake up in the morning thinking, I want a digital scan today. They don't care about what kind of machinery you are using. They just care about how that machine would enhance their smile makeover, or it can add value to their treatment plan. What patient really wants is confidence. Confidence they are making right choice. Confidence their treatment is properly planned. Confidence that expectations are realistic. Confidence there won't be any surprises later. And that's what digital planning provides. Once the patient understands the treatment, then they become the active participant in their treatment planning journey. Another major reason patients prefer digital dentistry is precision. Let's be honest, dentists most of the time working under millimeters, sometimes in the fractions of millimeter. A tiny difference can differ comfort, function, aesthetic or longevity. Digital planning allows us to gather information and measurement with the consistency that improves decision making. But this does not mean technology guarantees perfection, because dentistry is still biology. Every patient is different, every mouth is different, every healing response is different. But better information leads to better decisions, and better decision leads to better outcomes. One of the biggest misconceptions in digital modern dentistry that technology makes the treatment faster. But that's not entirely true. Technology exists to make the treatment plan better, and speed is just the byproduct. Let's understand this with a simple example. If you are visiting to a destination you have never visited before, so you can go for just driving and figure the things out on your way. Or you can use the navigation, know the route, plan the potential obstacle, or you can plan your journey even before starting. The destination may be the same, but the experience will be very different, and dentistry works in a similar way. When we gather more information before the treatment, we remove the unnecessary steps. We are not uncertain and we improve the coordination. And in many cases, treatment becomes more efficient. And that's why the concept of single day dentistry have become possible. People often hear single day dentistry and assume we are rushing. That's actually not true. In reality, most of the treatment plan has been done before even patients sit in the chair. Digital scans, digital design, digital communication, digital fabrication, all these things happen behind the scenes. And what looks fast to a patient is the outcome of digital planning. And that's really make an impact. Because speed without planning is dangerous, but speed which comes from preparation is efficient. Let's talk about another reason patient prefers digitally planned dentistry. Comfort. Not the physical comfort I am talking about. It also means emotional comfort, mental comfort, decision making comfort. Many patients delay dental treatment because they are anxious. Not necessarily because of pain, because of uncertainty. They don't know what to expect. They don't know how much treatment time it will take. They don't know whether it will be worth or not. And they don't know about this is the right decision or not. Digital planning helps reduce lot of uncertainty. And when patients know the treatment plan and the outcome, they feel more relaxed. Let's again take an example of Invisalign. The only reason patients want to go for Invisalign, not just only the aligners are clear. When the patient is going for Invisalign, the treatment plan is completely structured. There is a roadmap, there is a sequence, there is a plan. And whenever people understand the plan, they generally feel more comfortable moving forward. The same applies to implants, crown, veneers, smile makeovers, or full mouth rehabilitation. Patients don't simply want treatment, they want confidence, and confidence comes from understanding. Now this is very important and it needs to be discussed very honestly. Sometimes people assume technology automatically means better treatment. That's not actually true. Technology is just a tool, nothing more. A CBCT scan cannot diagnose a patient on its own. A digital scan cannot make a treatment plan. A smile design software cannot understand patient's expectation. A Invisalign smile simulator cannot replace the clinical judgment. These tools provide information, but information still require interpretation. And interpretation comes from experience, it comes from training, it comes from understanding biology, it comes from understanding people. That's why best outcomes comes when the technologies and expertise complement together, not when they replace each other. In fact, one of the biggest mistakes people make choosing technology over choosing the right professional. Technology matters, but person using it matters even more. Earlier, many patients simply accepted whatever the treatment has been suggested. But today, they ask questions. They research. They want to have options. They want to communicate about it. And believe me, it's a good thing. Because healthcare should never be a one-sided conversation. A good treatment plan can only happen when the doctor and the patient are on the same page. Digital planning supports this process because it creates a common language. When a patient can see the process and outcome, they are more relaxed and they are into the treatment along with the doctor. This improves communication, and better communication leads to better outcomes. If we remove all the technology, software, scanners, machines from the conversation, what do really patients want? Patient want clarity, patient want confidence, patient want comfort, patient want predictability. They want fewer surprises and they want to feel involved in these treatment decisions. And digital planning help us to move closer to achieve those goals. It doesn't guarantee perfection, nothing in healthcare can, but it can create often a transparent and predictable patient experience. At the end of the day, dentistry is not all about technology, it's all about people. Technology is simply one of the tools which we use to understand the problem better and make a treatment plan understandable for the patient with the predictable outcomes. The real goal remains the same as it has always been, helping patients eat better, smile better and feel better. It changes how patients experience dentistry. When the experience improves, everything else along with it improves. At Loma Dental, we use digital planning wherever it can improve patient understanding, precision and overall comfort. Whether it's Invisalign, smile designing, single day dentistry, veneers, crowns, implants or full mouth rehabilitation, our goal is simple: to make dentistry easier to understand, better planned and more predictable for every patient. Because modern dentistry should be fast, precise, comfortable.